Hello, my name is Melanie Ryan and I am your host today as we continue our discussion on the changes that have been made in the standards for assisted living facilities regarding the unlicensed staff person assisting residents to self-administer their medications. As stated earlier in part 1 of the program, we reviewed the standards for assisted living facilities and unlicensed staff persons assisting residents with the self-administration of medications. Now, in part 2 of this program, we will demonstrate the proper techniques to be used by the unlicensed staff persons when assisting the resident with self-administration of medications. Residents take medications for many reasons. Some residents take 1 or 2 medications a day, while other residents may take up to 8 or 10 medications a day. Some residents may take all of their medications once a day in the morning, while other residents may have their medications divided up into AM and PM and/or bedtime doses. In part 2 of this program, we will follow some unlicensed staff persons in assisted living facilities as they demonstrate the correct procedure for assisting the residents with their self-administration of medications. Before we get started with the medication procedures, let's review some important information regarding medication administration and safety. Medication safety is the responsibility of everyone who handles medications. The original 5 rights on the medication administration: right resident, medication, dosage, time, and route, have developed into the 9 rights of medication administration, adding the right documentation, the right to refuse, the right reason, and the right response. 9 rights of medication administration in ALFs assisting with the self-administered medications includes knowing that the right resident takes the right medication at the right dosage, at the right time, by the right route, for the right reason, has the right response, has the right to refuse, and is followed by the right documentation on the medication observation record, or MOR. Right resident. Make sure you know the resident. Identify resident every time and confirm by name, date of birth, picture on MOR, and/or other means of accurate identification. Use technology when possible, such as barcodes. Use picture or picture ID. Write medication. Check the medication label and order 3 times. Check the MOR, check the label, and then check MOR with the label. Read the label to the resident and verify the resident understands the drug dosage and reason for use, if known. Write dosage. Check the dosage amount. Triple check the label with the MOR. Write time. Check the time. Medications must be given at the time prescribed. Write route. Check the route. Confirm that the patient can take or receive the medication by this route: oral by mouth, topical creams, ointments or patches on the skin, ophthalmic drops or ointments in the eye, optic drops in the ear, nasal drops or sprays in the nose, and inhalers inhaled through the mouth. Unlicensed staff are not allowed to assist with the injectable, urethral, vaginal, or rectal medications. Write documentation. Properly document each dose offered on the medication observation record, or MOR. Document administration after giving the ordered medication. Chart the time, route, and any other specific information as necessary, including refusal of medication. Right response. Make sure that the drug led to the desired effect. If an antacid was given for heartburn, was the heartburn relieved? Does the patient verbalize improvement in depression while on an antidepressant? Be sure to document your observation of the resident and report to HCP. Right reason. Confirm the rationale for the ordered medication. What is the resident's history? Why is he or she taking this medication? Revisit the reasons for long-term medication use. If you are unsure of the reason for use, ask. Ask your pharmacist, doctor, or nurse. Right to refuse. A resident has the right to refuse a medication by Florida law. A resident may not be compelled or forced to take a medication, nor may you hide medication in their food or drink. Check the frequency of the ordered medication. Double check that you are giving the ordered dose at the correct time. Confirm when the last dose was given. Now let's review some information about medication errors. Medication errors are a global problem. Hospitals, emergency rooms, nursing homes, assisted living facilities, and community residents all make medication errors. To err is human. However, we must strive to minimize and continually reduce medication errors through medication safety practices. Some common types of medication errors are wrong time, omission of dose, wrong dose, extra dose, unauthorized dose, wrong drug, and wrong resident. Let's talk about how to prevent medication errors. Always triple check medications. Do's and don'ts can help you make sure that your resident's medication works safely to improve their health and well-being. Medication do's. 1. Do assist resident in taking each medication exactly as it has been prescribed. 2. Do make sure that all your residents' doctors and HCPSs know about all your residents' medications. 3. Do let your residents' doctors know about any other over-the-counter medications, vitamins and supplements, or herbs that they are taking. Medication don'ts. 1. Don't change your residents' medication dose or schedule without talking with their doctor or healthcare provider. 2. Don't share or use medication prescribed for any other resident or person. 3. Don't crush or break pills unless the resident's doctor instructs you to do so. Assistance with self-administration of medication by unlicensed staff includes the following. A. Taking the medication in its previously dispensed, properly labeled container from where it is stored and bringing it to the resident. B. In the presence of the resident, reading the label, opening the container, removing a prescribed amount of medication from the container, and closing the container. C. Placing an oral dosage in the resident's hand or placing the dosage in another container and helping the resident by lifting the container to his or her mouth. D. Applying topical medications.
E. Assist with the use of a nebulizer, including removing the cap of a nebulizer, opening the unit dose of nebulizer solution, and pouring the prescribed pre-measured dose of medication into the dispensing cup of the nebulizer. F. Use a glucometer to perform blood glucose level checks. G. Assist with putting on and taking off anti-embolism stockings. H. Assist with applying and removing an oxygen cannula, but not with titrating the prescribed oxygen settings. I. Assist with the use of a continuous positive airway pressure device, but not with titrating the prescribed setting of the device. J. Assist with measuring vital signs. K. Assist with colostomy bags. L. Returning the medication container to the proper storage. M. Keeping a record on a MOR when a resident receives assistance with the self-administration each time a medication is offered.
Now that we have discussed the medication administration and safety, let's acknowledge the fact that some residents live alone, as in the case of Mrs. Williams. She is a 70-year-old woman who recently entered the facility because she no longer could manage alone in her apartment. She and her family wants her to be alone to maintain as much independence as possible, but sometimes her family realizes she needs to be reminded often when and what medications she needs to take each day. The unlicensed staff person's responsibility in this setting is to assist the residents to safely self-administer his or her oral medications as ordered by the healthcare provider. Let's take a few minutes to review the types of oral medications the unlicensed staff person may be assisting the resident to take. Oral medications can be classified into the following forms: tablets, capsules, liquid, powders or granules, effervescent tablets. While there are different forms of oral medications, there are also different methods of taking these medications. Methods of taking oral medications include swallowing the tablet or capsule whole, with or without water, milk, or a beverage. Mixing the powder granules with water or juice as prescribed by the physician and then drinking it. The effervescent tablet is dropped into a glass of water, and after it dissolves, the resident drinks the solution. Buccal. The resident places the pill or tablet into his or her mouth between the cheek and the gum and keeps it in this position until it dissolves. Sublingual. The resident places the pill or tablet into his or her mouth under the tongue and keeps it under the tongue until it dissolves. Before assisting your resident with oral medication, you should have the following equipment ready. 1. Resident's medications. 2. Resident's medication observation record. 3. Glass of water or other beverage. 4. A straw if needed. Now that we have gone over the necessary equipment needed for oral medication administration, the following are the steps that must be followed when assisting your resident with their oral medication. 1. Wash your hands. Tell the resident that it is time to take his or her medications. 2. Remind the resident to wash his or her hands, or if necessary, assist the resident to wash his or her hands. 3. Assist the resident, if necessary, into a sitting position to safely take oral medications. 4. Bring the medications needed to the resident. 5. Review the medication observation record and remove the containers of medication from the box that you will need to assist the resident with for that time of the day. 6. Review the medication observation record with the tablets on the medication containers. 7. In the presence of the resident, take the medication container of the first medication recorded on the medication observation record that is to be given at that time of the day and do the following. Read the label to the resident. Example, Lanoxin, 0.125 milligrams. Take 1 tablet by mouth every morning. If necessary, open the container or medication bottle and place it on the table in front of the resident. Observe that the resident places the tablet into his or her mouth, or assist the resident to raise his or her hand with the tablet to the resident's mouth. Assist the resident as needed. Drink the water or beverage so he or she can swallow the tablet or medication. After the medication is taken, replace the cover on the medication if necessary. Repeat the above procedure until all the oral medications that are ordered for that time of the day are taken by the resident. Record your initials on the medication observation record in the appropriate places to indicate you assisted the resident to self-administer the oral medications for that time of day. 8. Put the medication containers and the medication administration record into a box and store them in a safe place. 9. Assist the resident to wash his or her hands if necessary. 10. Assist the resident into a comfortable position if necessary. 11. Before leaving the resident's room, wash your hands. Now that you have seen the proper procedures for the unlicensed staff person to assist the resident self-administer oral medications, let's review some important points to remember. If pills are to be crushed, the nurse will have to do this, and/or the healthcare provider will need to be contacted for approval. The unlicensed staff person may cut scored pills in half if ordered to do so on the medication label. Do not allow the resident to take capsules apart unless the nurse and/or healthcare provider ordered this to be done. The resident should not chew pills unless ordered to do so on the medication label or approved by the nurse and/or healthcare provider. The next procedure we will review will be assisting the resident with the self-administration of topical medications. Topical medications can also come in various forms, such as ointments, salves, creams, lotions, sprays. To apply these topical medications correctly, the resident should use the following methods for applying topical medications. 1. Apply in a thin/thick layer to apply skin as specified by the physician's order. 2. Rub into the skin as specified by the healthcare provider's order. 3. Spray onto the skin as specified by healthcare provider's order. You will need the following equipment. 1. Topical medication as ordered by the healthcare provider. 2. Medication observation record. 3. Gloves as needed. 4. Bandages or dressings as needed. 5. Paper or plastic bag for soiled dressings or bandages as needed. 6. Waste paper basket as needed. To properly assist your resident with topical medications, the following procedure should be followed. 1. Wash your hands. Tell the resident that it is time to apply his or her medication to the skin. 2. Remind the resident to wash his or her hands, or if necessary, assist the resident to wash his or her hands. 3. Assist the residents into a comfortable position if necessary in order to apply the topical medication. 4. Bring the topical medication, the medication observation record, and the equipment needed to apply the topical medication. 5. If the area that requires the topical medication has a dressing or bandage on it, assist the resident to remove the dressing or bandage. If it is difficult for the resident to remove the dressing or bandage, you will need to tell the nurse. The soiled dressing or bandage will be placed into a red plastic bag if there is a drainage, and then will be discarded into the biohazard receptacle. 6. Review the medication observation record with the label on the topical medication that is to be used at that time to assure that the topical medication is the correct medication that is to be used at that time. 7. In the presence of the resident, read out loud to the resident the label on the topical medication. 8. Open the topical medication container. The resident must put the topical medication in his or her hand or directly onto a dressing or bandage and apply the dressing. 9. If the topical medication is a spray, take the cover off the container and place the container into the hand. 10. Recap the medication container and remind. 11. Assist the resident to wash his or her hands. 12. Record your initials on the medication observation record in the appropriate place to indicate that you assisted the resident to self-administer the topical medication. 13. Wash your hands. 14. Place the topical medication in a safe place. 15. Assist the resident into a comfortable position if necessary. Medications can also come into the form of a transdermal patch. These patches are supplied in a package with a pharmacy label and will have several patches in one package. Before you begin assisting your resident with the transdermal medication, make sure that you have the following equipment. 1. The package of patches. 2. Medication observation record. Begin assisting your resident by 1. washing your hands. Tell the resident that it is time to apply the transdermal patch. 2. Assist the resident, if necessary, to wash the area of the skin where the patch will be applied. 3. Assist the resident to wash his or her hands. 4. Assist the resident, if necessary, into a comfortable position in order to apply the patch. 5. Bring the package of patches and the medication observation record to the resident. 6. Review the medication observation record with the pharmacy label on the package of patches to assure that the patch that is to be applied is the correct dosage as stated on the medication observation record and is to be applied at that time of day. 7. In the presence of the resident, read out loud to the resident the pharmacy label on the package of patches. 8. Open the package and remove one of the patches from the package and hand it to the resident. 9. Instruct the resident to apply the patch and, if necessary, assist the resident to apply the patch by guiding the resident's hand with the patch to the part of the body where the patch will be placed. 10. Remind the resident to smooth his or her fingers gently over the patch to keep it in place. 11. Record your initials on the medication observation record in the appropriate place to indicate that you assisted the resident to self-administer the patch at that time. 12. Assist the resident to wash his or her hands. 13. Close the package of patches and store them in a safe place. 14. Assist the resident into a comfortable position if necessary. Also, nasal medications come in multiple forms. Some examples are solutions, sprays, or inhalers. Equipment needed for this includes 1. Resident's nasal medication. 2. Resident's medication observation record and tissues. The procedure to be followed are 1. Wash your hands. Remind the resident that it is time for the nasal medication. 2. Explain the procedure to the resident and assist the resident if necessary. 3. Assist the resident into a comfortable position if necessary to receive the nasal medication. 4. Bring the nasal medication observation record, and the tissues to the resident. 5. Review the medication observation record for the nasal medication with the label on the nasal medication container to assure that it is the correct medication the resident is to be taking. 6. In the presence of the resident, take the nasal medication container and do the following. Read the label on the container out loud to the resident and hand the medication to the resident. If a solution or suspension with a dropper, observe that the resident draws up the prescribed dosage from the container. If a spray or inhaler, tell the resident how many times it is to be squirted or inhaled and into which nostril. Remind the resident to keep his or her head tilted back for several minutes so that the medication does not run out of the nostril. Offer the resident tissues as needed. Record your initials on the medication observation record in the appropriate place. Store the nasal medication in a safe place. 7. Assist the resident to wash his or her hands if necessary. The unlicensed staff person may assist the resident with the ear medication. The package of ear medications may have the following. 1. Bottle with eyedropper in it or attached to it, which will need to be rinsed out after each use and stored in a clean place. 2. If the bottle is without an eyedropper, removal of the top of the bottle will enable the resident to instill the medication from the bottle. Before administering ear medications, you need to have the following equipment available. 1. Ear medication. 2. Medication observation record. 3. Gloves if you need to hold resident's ear in order for the resident to instill ear drops. Procedure. 1. Wash your hands. Tell the resident that it is time for his or her ear medication. 2. Assist the resident to wash his or her hands if necessary and remind the resident to wash the ear with a warm cloth if you can see drainage. If you wash the ear, you should wear gloves. 3. Assist the resident to lie down or sit with the ear to receive the medication to be uppermost or tilted to the side. 4. Bring the ear medication, medication observation record, and gloves if needed to the resident. 5. Check the medication observation record and the label on the ear medication container to make sure that it is the correct medication and dosage. If the ear medication does not have an eyedropper, remove the cover and hand it to the resident, repeating the instructions for installation. 9. Observe that the resident is placing the medication into the correct ear as ordered by the physician. If an eyedropper is being used, remind the resident to gently place the dropper into the ear and to squeeze the rubber bulb on the dropper to instill the medication. Record your initials on the medication observation record in the appropriate place to indicate that you assisted the resident to self-administer the ear medication. Store the ear medication in a safe place. Assist the resident to wash his or her hands if needed. Wash your hands. The self-administration of eye medication is similar to the ear medications we discussed earlier. These eye medications may also be solutions with an eyedropper in a small bottle, solutions with no eyedropper in a small bottle. The equipment needed before administration is resident's eye medications, the resident's medication observation record, tissues, and gloves. The procedure for the self-administration of eye medication is as follows. 1. Wash your hands. Tell the resident that it is time for his or her eye medication. 2. Explain the procedure to the resident and assist the resident to wash his or her hands. 3. Assist the resident into a comfortable position if unable to do so by themselves. 4. Bring the eye medication, medication observation record, tissues, and gloves to the resident. 5. Review the medication observation record with the eye medication to assure that the label is the same as what is recorded on the medication administration record to be given at that time of day. 6. In the presence of the resident, do the following. A. Read the label to the resident. B. If using an eyedropper, observe the resident remove the cover from the bottle and draw up the prescribed amount of medication as directed on the label. Then remind the resident to tilt his or her head backwards and to use the other hand to pull down gently on the lower eyelid. Observe the resident squeeze the rubber top of the eyedropper so the medicine will go into the lower eyelid and not directly onto the eyeball. Remind the resident to close the eyelid and to move the eyeball around in order to spread the medication over the eyeball. Take the eyedropper or container from the resident and hand the resident the tissues. 1 tissue for each hand for each eye so he or she will not cross-contaminate if the resident gets eye medication in both eyes. Record your initials on the medication observation record in the appropriate place to indicate that you assisted the resident to self-administer eye medication. Store the eye medication in a safe place. Assist the resident to wash his or her hands if assistance is needed.
Before moving any further, let's briefly address the new rules which allow the unlicensed personnel to assist the resident with some additional procedures. Now assistance can be given with the use of a nebulizer, including removing the cap of a nebulizer, opening the unit dose of nebulizer solution, and pouring the prescribed pre-measured dose of medication into the dispensing cup of the nebulizer. Use a glucometer to perform blood glucose level checks. Checking the resident's blood sugar is a simple process using a lancing device, lancet, test strip, and a meter. The following are general instructions for using a blood glucose meter. 1. Wash your hands or clean your finger or other site with alcohol. If you are using alcohol, let it dry before you prick your finger. Explain the procedure to the resident. 2. Prick the site with a lancing device. Apply slight pressure to pricked area site with cotton swab. 3. Put a little drop of blood on a test strip. 4. Follow the instructions for inserting the test strip and using the blood glucose meter. 5. In seconds, the blood glucose meter reads your blood sugar level. The supplies you will use are the following: blood glucose meter, which reads blood sugar, a test strip which collects the blood sample, lancet or a small needle which fits into the lancing device, pricks the finger, and provides a small drop of blood for the glucose strip. Lancing device, which pricks the finger when button is pressed. Most devices have dials to select how deep the needle goes into the skin. Start with the middle depth. If you get more blood than needed, dial the number down so the lancet does not go as deep. If you get less blood, dial the number up so the lancet goes deeper. Alcohol wipes or soap and water to clean fingers or other testing site. Cotton swabs to effectively dry the pricked area and to apply slight pressure to the puncture site. Control solution checks test strip for accuracy. The amount of sugar in the control solution is already known. When placed on a test strip, value should match control solution value on bottle, package of strips, or package insert with your strips. Check strip comes with some models to make sure your meter is working. It checks the meter only, not the strips. User manual provides information about your meter. After reading it, place the manual in a safe place so that you can find it when you have a question about your meter. Assist with putting on and taking off anti-embolism stockings. Greet your patient and explain what you are going to do. This gives the patient an opportunity to assist you with the procedure and reduces anxiety around medical procedures. Check the size of the stockings to ensure they are the correct size for your patient. You will also want to ensure the patient does not have a latex allergy, as elastic may contain latex. Assist the patient in lying down on his or her back. Make sure the patient's feet are dry. You can apply talcum powder if they are not dry. Gather the fabric of the stocking into your hand and place it onto the patient's foot. Continue to roll the stocking upwards until the upper edge of the stocking reaches just above the patient's knee. Examine the stocking to ensure there are no wrinkles in the fabric, as this may be uncomfortable for the patient. Check the fit at the toes and heel to verify correct placement of the foot. Assist the patient into a comfortable position if he or she wishes to move. Remove your gloves and dispose of them safely. Repeat the hand washing procedure to avoid the spread of disease. While the resident is wearing the elastic stockings, you will need to regularly monitor them to ensure that all extremities are receiving adequate circulation. Check the patient's toes for signs of decreased circulation, such as coldness, slow refill, or discomfort. If the patient complains of numbness, tingling, or loss of feeling in any extremity, report it to the nurse immediately. Remove stockings every 8 hours to allow for adequate circulation. Removal of the stockings should be done by the doctor's order. Proper application of anti-embolism stockings is an important part of patient care and can help prevent life-threatening complications from occurring. Assist with applying and removing an oxygen cannula, but not with titrating the prescribed oxygen settings. Steps in assisting the resident. Put the cannula with the outlet prongs carved downward, fitting into the nares, and the elastic band around the head or the tubing over the ears and under the chin. If the cannula will not stay in place, tape it at the sides of the face. Pad the tubing and band over the ears and cheekbones as needed. Oxygen safety precautions. Teach family members and visitors to smoke only outside or in provided smoking rooms away from the client and oxygen equipment. Place cautionary signs reading "No smoking, oxygen in use" on the client's door, at the foot or head of the bed, and on the oxygen equipment. Instruct the resident and visitors about the hazard of smoking when oxygen is in use. Making sure that electric devices such as razors, hearing aids, radios, television, and heating pads are in good working order to prevent the occurrence of short circuit sparks. Avoid materials that generate static electricity, such as woolen blankets and synthetic fabrics. Cotton blankets should be used, and clients and caregivers should be advised to wear cotton fabrics. Avoid the use of volatile, flammable materials such as oils, greases, alcohol, ether, and acetone near clients receiving oxygen. Be sure that electric monitoring equipment, suction machines, and portable diagnostic machines are all electrically grounded. Make known the location of fire extinguishers and make sure personnel are trained in their use. Assisting with the use of a continuous positive airway pressure device, but not with titrating the prescribed setting of the device. Assisting with measuring vital signs and assisting with colostomy bags provide the resident with the necessary help to achieve optimal independence with activities of daily living.
Before completing this program, it should be mentioned that residents can experience side effects or adverse effects from their medications. Some of the more common side effects you may observe or the residents may make you aware of are the following. 1. Nausea and vomiting. 2. Diarrhea or constipation. 3. Sudden or continuous headache or dizziness, blurred vision or double vision. 4. Dry mouth, confusion, sweating, nervousness, heartburn, flushing of the body or face, weakness, cramping, or stomach discomfort. 5. Fast or slow heartbeat. 6. No appetite or increased appetite. 7. Insomnia or cannot stay awake. 8. Rashes or hives. 9. Any other signs or symptoms that are unusual for the patient. If any of these problems are noted or reported, the unlicensed staff person should tell his or her nurse or healthcare provider immediately. Assisting with the self-administration of medications helps the patient to maintain much of their independence at home. By following the procedures outlined in this program, you can provide a beneficial service to your patients while improving your clinical skills as well. Thank you for watching Assisting the Patient with Self-Administration of Medications. For National Educational Video, I'm Melanie Ryan.